Yeah, hi everyone. So I'll try to go pretty quick just so we have time for more questions at the end here. But we're going to talk about the volunteer satisfaction survey, our volunteer program growth that we've seen this year, and quality improvements that we've been working on for you all. So first up, we have our volunteer satisfaction survey, similar to our patient survey. We do this yearly, so we typically put it out in January. So this coming January, you can definitely look for this, and please make sure you answer it so that we can get this good data and make sure that we are addressing your needs and your concerns. We implemented quality improvement projects starting in April of 2023 based on all of this data. So these numbers here that you see, we're getting close to a year since the survey was collected. So we've been working on all of these different categories all year. So hopefully you all are seeing some improvement for some of these. This past year, we had almost a 20% response rate, which was great because it was up from a 12.5% response rate in 2022. Hopefully, we can get that up even higher in 2024. Make sure you look for this in your email. So you can see there on the right in the chart all the different areas that we were asking about. Several of these, we chose as target areas, some of them being tools and resources and feeling part of the clinic team. There are even more beyond that, but I'll stop there. But you can see we have the change from 2022 on the rightmost column. So for several of these, we went up. Some of them we went up significantly, like time commitment and learning new skills, which we're really happy to see. Some of them we went down. So like use of logistics or like our volunteer scheduling program, staff appreciation of volunteers. We see these numbers and we have been working hard all year definitely to address these concerns and try to create new solutions, new materials to help you, new programs, all different kinds of things. We also want to talk quickly about volunteer program growth that we've seen over the past year. So we've had a variety of new training programs come in. We have Northwestern Nephrology, Midwestern Physician Assistants, and Rush Dermatology. We're really excited because we've never had a physician assistant training program with us before, so that was a really cool step to take. We've also been able to provide some new opportunities to volunteers, probably the most notable being the microsite lab role, where we've been able to have volunteers be part of a smaller team, be a lot more hands-on with taking on triage and lab roles. So, getting patient history, but also doing blood draws, even giving vaccinations when you're ready. So that has been great addition to the program. We've also had our mobile health efforts, which I know a lot of you on this call have helped with and we've spoken about, as well as outreach efforts. Several of you have been able to help our outreach team by attending events, even hosting classes. And recently with our vaccination clinics, especially now that we're in upper respiratory disease season, a lot of you have been able to step up as vaccinators and come and just get tons and tons of our patients vaccinated with flu shots. So that's awesome. And then just some metrics. In 2023, we had over 250 clinic support volunteers onboarded. So we will say we have about 1,000. We really have over 1,000 active volunteers. So 250 more just in the past year. We've also been able to we've been able to onboard a lot of different providers. I believe Ava spoke a little bit about this earlier, but just being able to hit a lot of areas of need, which has been fantastic. And then we have a very exciting staffing update to provide as well.
Yeah, so I think some of you got a sneak. We've been rolling out emails starting today. Our beloved Milan is moving on the other side of the admin door, starting on Monday. So he's not going anywhere and you'll actually have more of him. Milan is going to be one of our newest clinic support coordinators. So he will be running clinics with you all. He will be supporting you all in lab, getting a lot more hands-on FaceTime with our volunteers, with our patients. I know he's going to be absolutely amazing. And he will, just a heads up, more emails to come on how this actually impacts you. He will be kind of, we're doing shared custody, as I've been calling it, for November. So Milan will still be with the volunteer team 2 days a week throughout November to ease the transition. So training programs, he'll still be your person. And then as of 4 p.m. today, I can also confirm that we have a new team member joining us, taking Milan's very large shoes starting immediately after in December, who is Max Starowitz, current front desk team member, former volunteer interpreter, Polish interpreter, lots of experience in as an educator, learning EMRs and scribing for providers. So loads of experience he's going to be able to pour immediately into this role. And I think is just such a, like, I feel beaming right now, like a perfect illustration of the workforce development piece that Steph talked about, and making sure that we have pipelines of pathways for staff to move up and around, for volunteers to become staff, to build that knowledge, which hopefully then all makes it so that we can support you as beautifully as we always want to. So hot off the presses, get ready to see a lot more of Milan in person versus in your inboxes. I know it's going to be amazing. We're going to miss you big time, but I know you're not going very far at all.
Thank you so much, Ava, and everyone else on the call. It's been such a pleasure to work with you all in an administrative role. I'm really excited to see your faces more and talk to you. I'm really excited for this change, and I'm really excited for the things that volunteer services will be able to do with our training programs. And I'm excited to just be with you all in just another form and fashion.
Thank you. All right. And then I think we have one last little thing to share, a couple of the quality improvements that we've been up to in volunteer programming, and then we'll open it back up for questions.
Yes, definitely. Okay. Quickly through the QI improvements. So like I mentioned, we really wanted to focus on feeling part of the team as one of our goals this year. It's really important to us that you all feel like you are just as much part of our team as paid staff, because as Ava has mentioned, there's a lot more of you, and really you see our patients as much or more than a lot of our staff. So to that end, we have a few different things we've done this year. Starting this week, we have video interpreting, as mentioned. We've also been trying to feature more of all of you volunteers, but also more of our staff on social media, to try to give you a little bit more information about them, so that you know who you're seeing when you come to clinic, you know what they do, what they're interested in, and you can connect a little bit easier. Make sure you're following us, especially on the Facebook page, because that's where most of our volunteer content gets posted. We had an in-person volunteer event for the first time since COVID in August. So thank you for those of you who were able to attend that. It was fabulous, our volunteer happy hour after our open house event. We also have a new TikTok channel, which does feature a lot of our volunteers. So make sure you follow at Community Health Chicago on TikTok to see those. And then this event, which hopefully this will become a recurring annual event. And then use of time was another big one. So we have our hybrid triage and lab role at our microsites. Since we see a much lower volume of patients there, we didn't want to have, one triager who was 30 minutes between each patient that comes in the door, and one lab volunteer who may or may not be able to get some samples depending on what patients need when they come in. So we combine those two roles so that you are kept busy and you feel like you are actually contributing during your time on your shift. We have the interpreter availability tracker to make sure that our interpreters are getting more calls, or at least an equal amount of calls on shift. Everyone's getting used equally, and hopefully not overworked or underworked. And then vaccine support. I talked a little bit earlier about all of our vaccine clinics to make sure that our providers can keep moving through their patient appointments and vaccinations get taken care of. I think that's the last one. Yep. And then Like I said earlier, our 2024 volunteer satisfaction survey is going to go out in January of 2024. So please look for that and make sure that you complete it. And our goal areas are still use of time and staff support, I believe.